Hi friends, good evening. I'm Dr. Ashutosh Gupta, and today we are going to talk about a sort of a difficult and a perplexing case. Right? Many a times we come across these cases which are really beyond the common understanding and are sort of an judgment. So today we are going to talk about one case which is an IVF, and it is a twin pregnancy. It is a DADC twin, meaning thereby that these are fraternal twins. And then we've identified some lesion in the fetal heart, right? And therefore, what we can make out is this, that we can really pinpoint to a diagnosis what we are dealing up with. And to have that particular diagnosis in both the fetuses in which we believe that both are the fraternal twins becomes very, very perplexing, right? So let us first see these cases and then we'll talk about the differential diagnosis and how do you investigate and how do you counsel. So look closely, this is what we are getting. So this is the left ventricle, and then we are getting this pedunculated lesion, and it is close to the interventricular septum. We are able to delineate the interventricular septum away from this lesion. So, but we can see this very sessile lesion, and then it is arising from the IV as interventricular septum. So, this is what we are dealing with, the twin A. So, if you can really look around, we can have an intervening membrane. So, this is the lesion. This is the twin 2, right? And the twin 2, what we can identify is the interventricular septum, and the similar same lesion, homogeneous but sessile, but then it is arising from the left ventricle, right? And then so this is a DADC twin with both the lesions and in the heart. So the lesions could be 4, 5. So this could be cardiac rhabdomyomas. We can have fibromas. We can have a myxomas. We can have a teratomas. So the teratomas are usually in the pericardium, and therefore we can have a pericardial effusion. And teratomas, they do have a mixture of sort of an cystic and a solid component. We can have a hemangioma, which we put the color and we can identify that this is a hemangioma. And myxomas are usually in the left atrium. And so the lesions that are being left out are only two, which is called as a rhabdomyoma and a fibroma. Now, rhabdomyomas, why we're talking about rhabdomyomas is this, that these are the commonest sort of an the lesions that we can identify in the fetal heart. And therefore they are sessile, they are not pedunculated, they can arise from the left ventricle, they can arise from the interventricular septum. And second are the fibromas. So fibromas are also on the similar lines. They can be identified in any of the wall, but they are usually intramural. So they are usually intramural. So meaning thereby that the diagnosis in the T1, in the 2 in 1, becomes difficult. That probably it could be a fibroma. In the second case, in 2 in 2, it can be a fibroma because it is arising from the left ventricle. But in the T1, it is arising from the interventricular septum. And why we're talking about rhabdomyomas are the, because then they're the commonest lesions. Now coming on to this very case specific, now we are dealing with the DADC twin. Both the babies to have the fibromas or the rhabdomyomas are really very, very intriguing, and it is very perplexing really to explain that both the babies now they have had this sort of an the TSC1 tuberin or TSC2 Martin lesion, and therefore we are having tuberous sclerosis, which could be there in the background of a rhabdomyoma, right? And usually we have identified that in two-thirds of the cases they are usually de novo, but to have both the fetuses to have that rhabdomyomas is really very, very sort of an intriguing so as to identify. We can really do now we are dealing all these things at 22 weeks, something on 21 weeks and 5 days. So eventuality is this, that probably if we intend to do the amniocentesis and try to look around for the exome sequencing or the gene sequencing both for TSC1 and TSC2, it will take some time. And then if it had it been a case, it would have been only one of the people would have been affected, then probably it would have been easier for us. But since both the babies are sort of an similar is the lesion, then we are identified in both T1 and T2. So amniocentesis would definitely be done for both of them, and to see for both TSC1 and TSC2 gene. And since we've identified, I've told you that in two-thirds of the cases it is usually de novo. So meaning thereby that we don't have any family history. In this case also we don't have any family history, somebody being affected with those cutaneous findings or a brain or a kidney. So the babies at the moment, they are absolutely clean as far as the all the four kidneys, all the two kidneys to both the twins, as well as the cortical tubers or the subependymal astrocytomas are there. So probably we are going to keep the babies under follow-up. So this is very, very intriguing that probably whatever it would be our differential diagnosis. So what we are identifying is this rhabdomyomas in both the twins, right? So this is slightly difficult to digest and to intriguing to explain, right? Thank you very much for your patience.